All right, I put this slide in because this to me is just amazingly fascinating. That is an electron micrograph of an osteocyte, that is a bone cell, and then a neuron. I mean, you can hardly tell the difference. So in terms of evolution, they are essentially the same thing. They just ended up in different parts of the body. This is a paper, the title is Molecular and Cellular Crosstalk Between Bone and Brain, Accessing Bidirectional Neural and Musculoskeletal Signaling During Aging and Disease. So this is stuff that is becoming more and more common in the literature. The very dense connections, neural, remember I told you how the Haversian canals, the microscopic structure of bone, are filled with nerves? There are massive connections between your bone and the rest of your body, and in particular your brain. And you can see all of these dendrites and axons and different little connections going to the cell body. Each one of those is providing communication, input, and changing things as you move in space, as things happen to you, as your body senses one micronutrient deficiency or senses an excess of another, as it senses too much cortisol, too little melatonin, whatever. All of this is communicated and goes back and forth, particularly between the bone and the brain. So a very similar what we call cellular morphology, meaning body shape, between osteocytes and neurons. And then there's cell migration from the bone to the brain. There's bidirectional molecular communication, meaning the brain talks to the bone talks to the brain. And then the proteomes, that is the protein that the osteocytes make and the proteins that the neurons make, have significant overlap. And we see this again and again in studies of degenerative disease of both the bone, osteoporosis, and the brain, dementia.